Welcome back to Moments That Matter for now this, our fourth season. We have some really exciting guests and interviews coming up over the next few weeks and months and really can't wait to share them with you. Kicking off this season is an interview with Dr. Teresa Williams about the continuing and evolving situation with COVID-19. She brings some much-needed clarity to a season of uncertainty and chaos.
Dr. Teresa Williams is employed in the upstate of South Carolina, working as a pediatric and adult medicine hospitalist. She has her medical degree as well as a master's in public health from the University of Alabama, Birmingham. She has been on this podcast twice before talking about the COVID pandemic, first in the spring of 2020, shortly after the outbreak, and then again in fall of 2020 when we saw the first resurgence of the virus. Well, here we are again, where no one expected to be, masking and social distancing and watching the infection cases rise once again, this time primarily due to the Delta variant of the virus. But this time is a bit different because in the spring of 2021, vaccines were first made available to the public. The vaccines have had a mixed reception, both in terms of acceptance by the public and effectiveness in warding off the new variant of the virus. So in some ways, we're right back where we were in 2020, confused and needing direction from a medical professional. That's why we're so delighted to have Dr. Williams back on the program. Welcome back, Teresa.
Thank you. Thank you for having me.
So maybe we can start today with you telling us what this past 12 months has been like for you as a hospitalist since we last spoke. What have you seen that gives you hope or makes you cautious or concerned?
All right. Well, let's start off with cautious and concerned and maybe end off with hope. So I think since I was on the podcast last, we've had probably a fairly large increase in number of cases. First in the winter time in January and February, and then we had a bit of a dip. And then, of course, now we're starting to see a resurgence again. And I think the biggest issue of concern for me is that with the initial surges, so in the very beginning, of course, we had this hope that we could flatten the curve with masking and social distancing. There were lockdowns and people were really doing whatever they could to try and really stop the spread so that we didn't overwhelm the healthcare system. There was a lot of support and a lot of kind of this mindset of we're all in this together. We're going to get through this. I think at that point, we were hopeful that it was going to be a few weeks, maybe a few months. I don't think anybody imagined we were going to be here a year and a half later, still with those same kind of pleas. And I think there's a lot of just a lot of fatigue from people not wanting to have to live this new normal anymore. People want to go back to the way things were. And for a while, there was hope that that was going to happen. And here we are again, unfortunately. And so I think that has been one of the toughest things, is just knowing how long this has been going on and realizing that, to be quite honest, I don't think COVID's ever going to leave us. I think it's always going to be there. I think as a physician, I was realizing that, 20 years from now, I'm probably going to be having conversation with students about how, I remember back in 2020 when COVID-19 became a thing. I think what we're going to have to do is just learn how to treat it, how to prevent it through vaccines, and how for people to live with it, just from a social and political standpoint, not to have so much division. So I think my biggest caution and concern, again, is the fact that we initially had distancing. We don't have that so much anymore. With a second surge, we had vaccines, which I think are the biggest hope for this whole pandemic. And now with this next surge, we really just don't have anything to put the brakes on anymore. There's certainly a cry from those of us who are vaccinated, those of us who are in healthcare, for those who are unvaccinated to go get vaccinated. But most of those people have very deep-rooted feelings and emotions about why they've not gotten vaccinated yet. And so trying to reach those people who are misinformed, those who are questioning, those who think that it's not important, trying to relay to them how important this is and what the very real dangers are. But it's much harder now than it was back in the initial onset of vaccination rates, just because there's that population of holdouts. And so we had things to kind of put the brakes on, and now we just don't have that anymore. So we're going full speed into this, what feels like a fire right now. And we're trying whatever we can, again, like we were a year and a half ago, to put that fire out. But people are tired. People are leaving their jobs. People are becoming burnt out. I've seen the fatigue on the faces of my partners. I've heard people saying that they can't continue at this rate. And we had hopes that things are going to slow down. And we kind of go into the day saying today's going to be a good day and we're going to make it and we're going to get through. But people are tired of having to say that without knowing that it's really going to get better. So I guess those are my biggest concerns, is what's going to happen to healthcare, what's going to happen to our capabilities of taking care of these people and others with other medical conditions, non-COVID related, if we're all so burnt out and fatigued that we don't have the workforce to take care of them. My hope, I guess, is, there is still a large number of people who are unvaccinated. And despite what we're seeing with breakthrough cases with COVID, the people who are vaccinated by and large are not getting sick. And so I think that's the most important message that I would give people, is that even though we are seeing people who are vaccinated get sick with COVID, so we may not be able to completely get rid of COVID through vaccination, there's still going to be breakthrough cases. Those people are not dying with COVID, or at least a very small proportion of them are dying with COVID. They're much less sick, and especially the younger population that we're seeing that are ending up on ventilators, those are all unvaccinated people. And so that doesn't have to be you if you can get vaccinated. So we do have information now that we didn't have a year and a half ago. We do have just the knowledge and experience with the virus itself. So there is some hope. I think that things will eventually get better if we can get our vaccination rates up, if we can get herd immunity up. That we will get to a point where COVID is nothing more than a bad cold, which is what it is typically for people who are vaccinated if you do get the infection. And if that's the case, then it won't be this big thing that requires us to mask and distance and stay away from each other the way that we have to now.
Can you give us a sense of caseloads these days as compared to, say, February, when things were kind of peaking?
Yeah. So just anecdotally from what I saw, I feel like our hospital, my community hospital, is definitely seeing more patients with COVID now than we did in January and February, where we felt like we were at our breaking point, and we're realizing that we have a new breaking point. Just looking at the numbers for my hospital system, even starting August 1st, from August 1st until yesterday, our caseload has quadrupled, which is just incredible to think about number of patients that we're seeing and the strain that that's putting on the system. It's hard for me to even imagine that 4 times the number of patients. And that was even August 1st, we were already starting to see an upswing from where we had been previously. And they weren't really reporting the numbers prior to that. So I don't have those, but it's definitely been a big upshoot just in the last 3 weeks.
What's been the reaction that you've seen among your patients to the vaccine, especially those who were unvaccinated coming into the hospital?
Yeah. So I ask every single person when they get admitted, whether they have had their vaccine or not, whether it's they're being admitted for COVID related reasons or not, because we do still offer it to our patients. I will say it's probably about 50-50. I have lots of very sick, chronically sick patients who have a lot of medical conditions that would put them at very high risk from COVID, who are still very hesitant to get the vaccine. And then, of course, I have others who say, I was first in line to get it. So it's a bit of a mixed bag whenever it comes to asking people those questions. I think part of that may be because the patients that I see that are chronically ill, who are ending up in the hospital, sometimes are people who don't take the steps that they can to help take care of themselves. And that's why they're in the hospital with various things, whether it's COVID or not. So that may be where some of that bias is coming. But Yeah, there definitely are a lot of questions that I try and address and answer whenever that comes up with my patients. I will say for those who are being admitted with COVID, the vast majority of them, of course, are unvaccinated. The very few handful of patients I've had that have been vaccinated with COVID, to be quite honest, are being admitted for other reasons, and just happen to also have COVID that might have caused some mild diarrhea that gave them some dehydration, or they may need a very small amount of oxygen, maybe 1 liter of oxygen, but they usually leave the hospital pretty quickly and are, even those who have a lot of health conditions that I have personally taken care of with COVID, have been very minimally affected from the COVID itself. It's always an interesting question to ask. Of course, we ask if they're vaccinated or not. And again, the vast majority are unvaccinated. I personally don't really push as to why, because at that point, I feel like the guilt is already there and there's already a lot of questioning and a lot of what if. But I know that there are definitely a lot of people who, my partners who I've talked to, who have regretted that decision not to get the vaccine, definitely at that point. And it's been interesting. I've asked a lot of people about their family members. How are their family doing? How's your husband or wife doing? Were they affected? And a lot of times the answer is no, they didn't get it. They were vaccinated. And so I know that there's a lot of thinking through in their mind. I know I wouldn't have been here had I gotten the vaccine like my spouse did, who was around me and did not get the virus.
In spring of 2020, right before our first interview with you, you had a scare with COVID thinking that you had contracted it. You hadn't, but just recently, that concern was realized, causing you to be numbered among those who had a breakthrough infection. Can you tell us about that?
Yes. So unfortunately, about 2.5 weeks ago, I was exposed to a patient unknowingly who had COVID. And so even though I was wearing our recommended PPE, didn't have full COVID PPE because we didn't know this patient had COVID at the time. And with that, after finishing my shifts, started to have some very mild symptoms. So just runny nose, a little bit of some body aches, sneezing, nothing overwhelming, but knowing that I take care of COVID patients and knowing that I was going to be taking care of infants and I didn't want to expose unnecessarily anybody else. I took a COVID test and unfortunately it was positive. There was a lot of frustration, a lot of, just a lot of emotions that came with that, thinking I've done everything I can, and yet I still got this. And why now, 18 months into it, when I'm fully vaccinated, would I get this virus? But I think the good news was that my case was very mild. I hardly had a cough at all. It was mostly just runny nose, body aches, a little bit of feeling tired, and recovered fairly quickly. And I think that really is thanks to being vaccinated. I think my symptoms probably would have been far worse had I not been. And just that peace of mind, knowing this is probably not going to land me in the hospital. Those who I had been around prior to knowing that I was positive were all vaccinated, thankfully. And our 2 children who are too young to be vaccinated, they of course were around us. But we wore masks the entire time that we were infectious in our home. We used hand sanitizer like it was going out of business. Bottles all around the house, distancing as much as you can from a 2-year-old and 4-year-old, not picking them up, not hugging them. That was very hard to do for 2 weeks. But thankfully, they never had symptoms and they were negative. So I think the experience to me proved, one, that it is possible to still get COVID when you're vaccinated. So you do still need to be cautious. You need to wear your mask. You need to be cognizant of being in large crowds of people. Delta variant is out there. It's highly infectious. People are infecting a lot more people per person who is sick. So that, I think, was a big eye opener to me, that it's possible to get sick even though you do those things and you are vaccinated. 2, being vaccinated, my symptoms were very mild. And I don't think I spread it. As far as I know, Scott's the only person who got it from me. So didn't spread it to as many people as I think I probably would have had I been unvaccinated and had probably a higher viral load for a longer period of time. And 3, that masks and distancing, again, work because our kids didn't get it either, despite being in the house with us and being unvaccinated. We did everything we could to prevent that transmission, and they were negative.
And that sounds very much like spring of 2020, actually, with medical personnel having to just not be able to be, around family. And I mean, it's just, it is absolutely remarkable that we are right back. So since you just mentioned Scott, I'll bring him into the conversation because we haven't heard from him yet. Scott, you had a more severe case of the breakthrough virus. And so because, people hear about this too, that it's not just a runny nose, and so I want to give them some assurance through your situation that you had more severe symptoms, but nonetheless, we're not hospitalized, and here you are alive among us. Can you talk about your symptoms a little bit?
Yeah, you bet. When Teresa tested positive, it was a Sunday afternoon, and I walked around thinking, no problem. Teresa's got it. I'm not going to get it. I'm just fine. I remember back when the swine flu came through, and I was teaching school, middle school and high school, and it was wiping out our school. I ended up getting it, and it wasn't really bad. I had it for probably 36 hours and it was gone. I had it over the weekend and I was back in school on Monday. Watching Teresa's symptoms, I thought, this is no big deal. I'll get it. I'll have the same sort of reaction. Interestingly enough, though, she and I were vaccinated with 2 different vaccines, Teresa with a Pfizer, and I won't say what I had, but it rhymes with Moderna. And so that was a great test. Teresa said, this is going to be a test of vaccines. Let's see which one, powers up more. Well, Teresa, when she was vaccinated, had very few side effects with the vaccine. I had more side effects. Mine lasted about 36 hours maybe. And the infection, when I tested positive for COVID on Tuesday, after Teresa did on Sunday, started with the same progression of symptoms as the vaccine side effects whenever I got the vaccine. And it was just longer, more drawn out, and a bit more acute. And so for me, it started with feeling a bit off. You just have that sort of odd feeling like something's amiss, and the body ache set in. And that was pretty miserable for a bit longer than I had sort of body aches when I had the vaccine. Then the fever started. And so Tuesday afternoon, I tested positive. That night, I felt a bit achy. Wednesday morning, I felt a lot more achy than Wednesday, probably midday. I had the fever. The fever shot up between Wednesday afternoon, and it broke about Thursday morning around 4. And then the fatigue set in. And that was probably the most significant of the symptoms. I didn't really have a cough. I haven't really had much of a cough since then. For me, it kind of was almost mirrored a cold with some congestion in the head. But for me, the worst thing I think was the fatigue that set in after the fact. My heart was racing really for a couple of days. And I think that just was so exhausting that by probably Friday afternoon, I was starting to kind of come back around a little bit. And so it was frustrating to me because I watched Teresa, who had so few symptoms and was up and at 'em, and I was bedridden for at least 2 days and kind of came around on the 3rd, but was so grateful that the both of us, we have no lasting symptoms. Teresa, just from what she said and seeing people in the hospital, there are some that have these fevers that go on for days or weeks. Or they seem to improve and then they take a couple steps back. And for us, there's not been any of that. And really, it caused me to wonder, of course, now I'm an old man. When you get my age, nearly 40 years old, maybe I don't bounce back as quickly as I used to. But I did wonder, had I not been vaccinated, would I have had a more significant case? And I'm grateful that I don't have to answer that question and wonder, maybe I should have been vaccinated, and here I am still suffering or had a more difficult issue. I never had any breathing problems. I never felt short of breath. Really, for me, the biggest was the body aches were terrible, and the fatigue after the fact was pretty significant. But so grateful for the vaccine. Would still get it. Would absolutely encourage anyone to get it, because that big question of what if, Teresa has often said, on the far end of the spectrum is potential for death with COVID, and anything you can do and any side effects less than that is not a terrible gamble. And so grateful that here we are. We've made it through our quarantine, our isolation. The girls didn't get it. We're so grateful for that. And here we are to tell the tale.
So Teresa, maybe you could enlighten us as to how these breakthrough cases are happening among the vaccinated population. And I'll just ask the question that some ask, which is, does that mean that the vaccines are ineffective?
Yeah, so that's a great question. I think the biggest driver of what we're seeing right now is probably this Delta variant that depends on which study you read, but is definitely the majority of the cases that we're seeing right now in the US. And I think the biggest issue with Delta is just that it's a much more highly infectious kind of variant of the disease. So basically what that means is we think that you have a much higher viral load in your throat and your nose. And so you're just going to be more likely to spread it to others. There's some question about whether it truly makes people sicker than previous variants of the virus. I'm not sure if anybody's really proven that one way or the other. I will say that we're seeing a younger, probably more healthy population. And I think that's just a byproduct of the fact that those are the people who are unvaccinated. So I think that's why we're seeing those people get so sick with this variant. I think those are also the people who are going to be more likely to be interacting without masks and large groups of people who are going to be the ones getting the virus. So I think what we're seeing again is just a higher infectious rate with the variant that we have. And I think we have differences in the way people are interacting now than they did at the beginning. So we're not masking anymore by and large. People are not distancing the way that they used to. People are trying to go back to life as normal, even as the world around us, for all intents and purposes, is burning down to the ground. And people are still trying to go about their normal lives as if it's not happening, thinking that they're going to make it through unscathed. And unfortunately, that's not been the case for a large number of people. So I think that's kind of what's been driving this big surge that we've been seeing. Whether that means vaccines are ineffective, I don't think that's the case. I think we are still definitely seeing, to me, the bottom line is that if you get COVID, are you going to die from it? Or are you going to end up hospitalized? That's the biggest thing that you want to see with those who are vaccinated. And we're not seeing that. Even those who are getting breakthrough cases, their symptoms are much milder than those who are unvaccinated. So if your endpoint for the vaccine is, will it prevent me from having a serious illness or a death? Then I think it's absolutely effective in that way. We're still seeing percentages the same way that we did at the very beginning of vaccine studies when they were all published. 90% of people, for the most part, are not going to have serious illness or issues from COVID if you're vaccinated. Certainly, like I said, and like Scott and I have been an example of, it's possible to get COVID, which means you can still transmit it to others who are unvaccinated. So I do think one thing that we have to be cognizant of that we maybe didn't realize before is that you can still get it. So just being vaccinated doesn't mean that you're not going to get COVID or you're not going to spread it to someone who may get very sick from it. I think there's still a lot of unknowns about vaccines and about how long they're efficacious, about our immunity levels with them. Are we going to need boosters? I think those are things that are, to be quite honest, we're still gathering data on. And there's still some questions. There's still lots of questions around COVID, but I think that's one of them. But I don't think at all that means the vaccines are not effective.
And speaking of how long the vaccines are effective, what's your take on the recent CDC recommendation for a third vaccination as a booster for those who are vaccinated?
Yeah. So officially, the CDC's not actually made that recommendation. They think it's going to be coming forward. They're thinking they might start third vaccination doses in September. But if you look on their website now, they actually say that they still are gathering information about that. So it's not been an official recommendation yet. They do recommend that those who are immunocompromised get a third dose, which is actually a little different than a booster dose. So a third dose, their recommendation is that if you are someone who does not have a normal immune system, meaning you're not going to mount the response that we might expect from someone who does have a normal immune system with the vaccine, that you may need 3 doses rather than 2. So that their typical kind of schedule for that would be you would get your first vaccine, whether it's Pfizer, Moderna, or this is talking about the mRNA vaccines more specifically. So Pfizer and Moderna vaccines. You would get your first dose and then your second dose either 3 or 4 weeks later. And then about 28 days after that, you would be eligible for a third dose if you are immunocompromised. So that is just to get your levels of immunity up to where we would expect them to be in somebody who has a normal immune system who may only require 2 doses. So that is an official recommendation from the CDC at this time. As far as booster doses go, for those who have normal immune systems, there certainly are countries who are doing that now. Israel is doing it. The UK is about to start rolling out a booster program for their residents. And again, the US has said that they think it may be coming in the fall. I think right now, to be quite honest, there's a lot we still don't know. We don't know whether immunity is truly waning. It certainly appears to be when you have people who are having more breakthrough cases, but we don't know if that's because we have a variant that's more highly infectious. So is it possible that you're just being exposed to higher viral load? So then you're overwhelming the immune system and you can't mount a response fast enough. It's not that the vaccine's not effective, but you can't respond fast enough in order to prevent the infection. It's just not going to be as severe. So is that why we're seeing breakthrough? And if that's the case, will a third vaccine really make a difference in that response time? It's possible. It might allow you to get some more antibodies that might respond in a faster way. But I think those studies have not yet been fully completed. And I think that's why the CDC's not officially made that recommendation. I know they're looking into that. I think the difficult thing with COVID is things are happening so quickly. Like I said, in the matter of 3 weeks, we've quadrupled our caseload here in the upstate. And so we as physicians and as scientists are trying to do whatever we can to stop the fire from burning. But sometimes we have to do that without the rigorous studies that we would love to have that might give us great evidence for the things that we're doing. And that's not to say that studies are not happening and that they're not gathering that data. But I think we're having to try and weigh the incomplete data sometimes that we have against the risk of what's happening around us and what can we do to try and put out this fire in the meantime while we're trying to gather this evidence.
Speaking of that, we've made mention about masking and how good we were at it at one time and how maybe not so good we are at it at this moment. So an issue that's come up lately that's turned into a very much a political hot potato is masking in schools and a masking mandate, and not just schools, but businesses and others. Can you tell us from a medical perspective, thoughts on kind of where the medical community stands with those recommendations or those mandates or the lack of a mandate?
Yeah, so trying to keep this as apolitical as possible, because I know this certainly is a big issue for many people. We know that masks work. If they didn't, I wouldn't wear them every day at work like I have been for the last 18 months. I wouldn't have worn them every single day in my home to keep my children from getting COVID, and they didn't get COVID. Certainly there are levels of protection for masks. There's cloth masks, there's N95 masks, and there's everything in between. And the way you wear them, if you wear them correctly versus whether you're playing with them all the time, of course, there's going to be different levels of effectiveness. But I think the biggest issue that people are talking about right now is masking for children, because the vast majority of children, especially those under the age of 12, are unvaccinated. And we are starting to see an increasing number of these children getting hospitalized with COVID. I've seen in our hospital system, those numbers have gone up dramatically again in the last 3 weeks, and in patients who are getting hospitalized with COVID who are children. And so what can we do to protect them? And to me, the easiest thing we can do is to try and put a mask on our child. Most of them do just fine with it. My little girls love wearing their masks. They ask to wear a mask whenever we go somewhere because that's become the norm for them. And I think if we think about what we can do to protect our children and what we can do to protect the community and those around us, it seems like such a simple thing. I certainly think that it's unfortunate that it's become a political issue. I think it's unfortunate that some governments have prevented school systems from looking at the evidence and trying to make the best decision for what's going on in the community. We've had school systems around us that have had to go virtual because of already incredible numbers of cases, higher numbers of COVID students than they had at any point in the year last year. And I think some of that is a direct result of trying to go back to life as normal, not masking, not distancing, not using plexiglass dividers, not doing the things that we were doing last year to really try and slow this spread. And so I think there are some very simple things we can do that we've demonstrated are effective. Flu rates, RSV rates were at incredible lows last year, lowest cases that we've ever seen. And I think that's also a direct result of masking. And so if there's anything we can do to try and protect our children's education and keep them in school, doing the things that we want them to be doing, then that's a very small thing that I think that we can do. So children, and even though I'm sure a lot of teachers and staff members are vaccinated now, like I've said, you certainly can still get it if you're vaccinated. So I think having everybody wearing masks is just a very small thing that we can do to try and slow down this fire that's burning.
Is there anything else that you'd like to share with our audience?
Yeah. So again, I think I've just seen so much fatigue and burnout and people really reaching their breaking point. And I think some of that has become the political side of things and the emotional aspect that's been involved with this. I think some of that is just watching people die, talking to their families, having remorse and regret with these families who've not been vaccinated, and watching them walk through that process, watching school-age children have to say goodbye to their parents when that should never be the case. We shouldn't be watching people in their 30s and 40s die, but we are. I've been personally very affected by the stories of some of my patients that I've watched go through this process, watching their families, calling a woman who was my same age and telling her that her husband was not going to make it, and having her ask me how she can tell her 3 young girls how they're going to deal with this. And so that's just something that's been very disheartening for me to watch. But I think one thing that I, as a Christian, kind of come to at the end of the day is still knowing that despite all of this, God is so much bigger, and He is the one who knows how we can make it through. When we hit our breaking points and when we hit our lowest level, we know that He walks us through and He gives us strength that is beyond what we have. And so I encourage those of faith to reach out and to understand that God is bigger than this. And we're going to make it through. It doesn't seem like it when we're here now for a 3rd time talking about this. But there is going to be an end to all of this, and we will, as a community, come through it all. And so I think just realizing, and sometimes we have to get to that breaking point to help us to know that God is going to be the one to get us through it. But I think that has been the biggest lesson for me to learn when I've been at the end of my rope so many times. I think every shift I come home and I say, I think I'm just going to quit. but knowing that God's going to get me through the next shift and the next set of patients that I have to take care of and the next family members that I have to talk to and have those conversations with.
Yeah, and here we are approaching the 20th anniversary of 9/11, and there was a lot of recognition of the first responder community during, in the aftermath of that, and all we could do was just applaud and recognize and identify and that sort of thing. There was very little any of us could have done, to really affect any kind of change in that situation. Same situation really in spring 2020. People were very kind, to recognize the medical community and, all of the sacrifice and everything else like that. But again, little that could be done, in an individual part. But now it just seems like we have so much that we can do as individuals, and to not do those things, and to watch the medical community and our friends, our relatives, just suffer like they are. It's just beyond imagination, actually, at this point. So I just encourage our listeners to really heed Teresa's words and advice, and just recognize that her story is being replicated all over the world in the medical community, and it is time to bring this thing to its knees and to its end. So we're just really grateful, Teresa. Thank you so much for joining us. And thank you to all of you who have joined us today. And we hope that you'll be back with us next time on Moments That Matter. Thanks.
Thanks.
Thanks for listening to Moments That Matter, a podcast that looks at the moments in our lives that come along from time to time that have consequences long after the moment, especially those moments that have to do with the choice of vocation. In his book, Let Your Life Speak, Listening for the Voice of Vocation, Parker Palmer speaks of a clearness committee in the Quaker tradition, wherein a group of older, wiser people ask questions of someone considering a life choice as a way of clarifying the next step. We may not meet with a committee about these big decisions, but we all have these critical junctures in our lives, which we can think of as clearness committee moments. We need to pay attention to these moments because they are profound and potentially life-altering. We'll relay stories from our lives and interview others about theirs, especially noting the clearness committee moments, those we choose to recognize and those that were sadly ignored, those decisions that were made with God in mind and those that were not. Our hope is that these podcasts will cause you to think of the same kind of moments in your life with new clarity.